In this video, we're talking about how to fix your plantar fasciitis. A lot of the information in this video is from the research done by Scherger et al. In 2007. First, we're just going to be talking about some basic anatomy, then some risk factors and causes, and how it is diagnosed, so that you know if you actually do have plantar fasciitis, and then a few ways to solve your plantar fasciitis pain. And then stay to the end of the video for a fun fact that will hopefully mildly amuse you. Anatomy. The plantar fascia is a dense fibrous tissue spanning the length of the foot. It originates at the medial calcaneal tubercle and attaches to the phalanges, or your toes. Plantar fasciitis is defined as inflammation of this tissue. Some risk factors include overtraining, being obese, pes planus, tight calf muscles, excess stress or repetitive strain injury. So if you're walking or standing for hours on your feet, then inappropriate footwear. For the diagnosis of plantar fasciitis, in a subjective assessment, the patient would usually say that pain started in or around the heel area, but then the pain stretches across the length of their foot. They would also say that the pain is usually worst in the morning when they first stand up or start walking after sleeping the whole night, or getting up after sitting down for a long time. This is because when you are lying down for such a long time, your plantar fascia gets stiff and shortened when you are in that position for such a long time. And when you stand up, it suddenly stretches and causes micro tears, which then brings on pain. They would also say that the pain usually gets less and less throughout the day as they are walking throughout the day. If it gets worse throughout the day, then it might be something else, such as bursitis. An objective assessment would include a sharp pain upon palpation of the medial plantar calcaneal region, and also discomfort in the proximal plantar fascia when dorsiflexing. Now on to the treatment. First, we'll talk about some things that you absolutely must do when you first get up in the morning, and then we'll move on to some strengthening exercises that you can do throughout the day. 1. A massage. Make sure you're rubbing across the fibers of your fascia. You can press quite firmly with your thumbs, as I'm doing here. Start closer to your toes and then work towards your heel, where the pain is most severe. If you don't want to touch your feet in the morning, then you can use a ball the size of a lacrosse ball to just give yourself a massage before you start walking or standing up in the morning. You can rub side to side as I'm doing here, or you can just rub across. You can even start standing on it if you would like. Next, what you can do is stretch the fascia in the morning, as I'm doing here. Make sure you get all your toes, even the baby toe. The last stretch would be stretching your calf muscles, namely the gastrocnemius and the soleus. Straighten your knee to stretch your gastroc, and then bend your knee to start stretching your soleus a bit more. As recommended by Scherger et al. In 2017, this next exercise is called the foot grip exercise. Participants in his study only took 1 to 2 weeks before their plantar fasciitis was cured. He mentions that patients who performed this exercise were much less likely to experience a relapse of plantar fasciitis. And lastly is just using a splint to keep your foot in dorsiflexion. As we talked about earlier, if your foot is in plantar flexion the whole night, your fascia gets stiffened and shortened throughout the night. So the splint just holds it up in place to make sure that the fascia doesn't stiffen up. This has been found to be very effective. If you have problems with severe pain when getting out of bed in the morning, this will definitely help you. You can get one online or you can make one at home as I have. If this video really helped you, it would help me out a lot if you like, subscribe and turn on notifications. And as promised, we have 900 ligaments in our bodies, and the plantar fascia is the biggest of them all. Don't worry about it.